Understanding Pet Mental Health, the Hidden Struggles of Our Furry Friends. Singapore, have you ever thought about how your pets might be feeling? For Ms. Gemma Kyle, the journey to help her four beloved cats live in harmony turned out to be quite the challenge. When she welcomed two new furry friends, Toto and MIA, into her home, she never imagined the chaos that would ensue, especially for her timid cat, Millie. At just 3 years old, Toto and 2-year-old MIA were full of energy, but their introduction to Otto and Millie, the older cats, sparked unexpected territorial disputes. Millie, the smallest and most anxious of the bunch, found herself on the receiving end of aggressive behavior from the newcomers. Ms. Kyle, 38, had adopted Otto and Millie in 2021, both of whom were rescued street cats, and she was determined to create a peaceful multi-cat household. However, about a month after Toto and MIA arrived, things took a turn for the worse. The couple's attempts to integrate the cats physically led to constant chasing, hissing, and growling directed at poor Millie. Despite their best efforts to foster a positive relationship, nothing seemed to work. After months of trying various strategies, including seeking advice from a seasoned cat rescuer, Ms. Kyle and her husband decided it was time to consider medical options. They turned to Dr. Daphne Ang, a veterinarian with 17 years of experience, who introduced them to a range of treatment possibilities. This included adjusting the cat's living environment, managing their interactions, and even prescribing fluoxetine, an antidepressant that has shown promising results in reducing Mia's aggression. While Mia's behavior improved, Toto continued to be a challenge, prompting Dr. Ang to explore additional medication to help him adjust. According to Dr. Ang, the emotional well-being of pets is just as crucial as their physical health. Like humans, animals can experience mental health issues such as stress, anxiety, and emotional disorders, which can lead to significant behavioral changes, she explains. Dr. Ang is on the verge of making history in Singapore by becoming the first veterinarian to achieve board certification in veterinary behavior, a field that focuses on understanding and treating the mental and emotional health of animals. She is currently completing her residency with the American College of Veterinary Behaviorists in Florida, where she has gained invaluable insights into this specialized area of veterinary medicine. Dr. Teo Boon Han, president of the Singapore Veterinary Association, echoes Dr. Ang's sentiments, emphasizing that an animal's mental state is a vital component of its overall welfare. A poor mental state can lead to decreased nutritional intake and reduced quality of interactions, and chronic stress can result in various health issues, he warns. The importance of addressing mental health in pets cannot be overstated. Dr. Ang's dedication to this field stems from her recognition of the gaps in veterinary science regarding animal behavior. As a mother of 3, she has seen firsthand how many pets are not receiving the comprehensive care they need, which includes both physical and mental health considerations. Veterinary behavior is a unique branch of veterinary medicine that aims to enhance the quality of life for animals through a combination of medical treatment, behavioral modification, and environmental adjustments, much like how human psychiatry approaches mental health. Take Ms. Chu Oi Yi, for example. She was baffled when her dog Oreo, who had always been friendly with the family's other dog, Cookie, suddenly began picking fights. After months of escalating aggression, including an incident where Oreo bit her husband, Ms. Chu sought help from Dr. Ang. Although the cause of Oreo's behavior change remains unclear, a combination of fluoxetine and gabapentin has significantly calmed him down. While some pet owners might consider consulting a pet communicator, Dr. Ang cautions that these individuals, despite their good intentions, cannot replace the expertise of a veterinary behaviorist. Pet communicators lack the ability to diagnose medical conditions and often miss underlying health issues that could be contributing to behavioral problems. Dr. Teo adds that behavior issues in animals should be approached scientifically, emphasizing the importance of seeking professional help from veterinarians or trusted trainers to rule out any medical conditions. So, what are some common mental health issues that pets face? According to Dr. Ang, factors such as early learning history, genetics, and environment can all influence an animal's vulnerability to mental health challenges. Adopted or rescued animals, in particular, may be at a higher risk for attachment and behavioral issues due to their often traumatic pasts. Signs of anxiety in pets can include excessive vocalization, restlessness, or destructive behavior, while symptoms resembling depression may manifest as a loss of interest in activities or changes in eating and sleeping patterns. Stress-related disorders can also arise from environmental changes or disruptions in routine, leading to chronic stress that affects both physical and emotional health. For pet owners, the priority should always be to ensure their furry companions are happy and healthy. Ms. Kyle emphasizes the importance of creating a safe and secure environment for each cat in her household. While it would be wonderful if they all became friends, our main goal is to achieve peaceful, stress-free cohabitation where everyone can live without fear, she says. Dr. Ang stresses that addressing these complex issues requires individualized, holistic treatment. By being attentive to their pet's mental health, owners can foster a more harmonious and supportive environment for their beloved animals.